All right, engineers, in this video we're going to talk about the sacral plexus. So we already talked about the cervical plexus, we talked about the brachial plexus, we talked about the lumbar plexus. If you haven't seen those videos, at least go back and watch the lumbar plexus because it's going to feed into the sacral plexus. So first off, if we look here, the sacral plexus is actually going to be coming from about L4, L5. It's also going to go down to S1, S2, S3, S4, S5, and coccygeal 1. All right. So this is a pretty big plexus. One of the main nerves that are coming off of the sacral plexus is actually going to be a very, very important one called the sciatic nerve, and we'll talk about the clinical correlation with that. Okay, so what happens here is we're actually going to have the first nerve here. Let's see. We're actually going to have, let's take here and we'll have a line here for L4, then we'll have a line here for L5, and we'll put a line here for S1. Now what happens is there's a nerve that's actually going to pick up some branches from L4, L5, and S1. So L4, L5, and S1. Let's draw this guy. Let's do this one in a nice bluish color here. So if we start here, let's say we start about right here, and we're going to take these fibers up. So if we have the fibers from S1, we're going to take some fibers from, what else? L5. We're going to pick up some other fibers from L4. So we're going to have L4, L5, and S1. This is actually going to form a very, very important nerve that's going to supply the gluteus medius and the gluteus minimus. This is actually called the superior gluteal nerve. So this nerve is primarily going to be that of motor nerve. It's primarily a motor nerve. So superior gluteal nerve. And the superior gluteal nerve is important because what do we say it supplies? It supplies two main muscles. So one of the muscles is actually going to be the gluteus medius, and the other one is going to be the gluteus minimus. And these are important muscles because they're abductors. So they pull the actual hip away, right? So they're abductors. So gluteus medius and gluteus minimus. Okay, so that's the superior gluteal nerve. The inferior gluteal nerve is actually going to be just one branch down. So now it's going to take fibers from L5, it's going to pick up fibers from S1, and it's going to pick up fibers from S2. So what is this nerve right here? Let's actually have him coming up now. So let's have a branch here. Let's say this is our S2 here. And if we have these fibers coming up here, so we're going to have fibers here from S2. We're going to have fibers here from S1. And we're going to pick up some fibers from L5 here. All right? And then also you're going to have fibers from L5. If we have this right here, this is going to form what's called the inferior gluteal nerve. So this is going to form what's called the inferior gluteal nerve. And this is the one that supplies the big mama. This is the Gluteus Maximus. So this is going to supply the Gluteus Maximus. And the Gluteus Maximus is important because it provides two functions. One of the functions is it's going to play a role with an extension at the hip. And it's going to play a role with lateral rotation at the hip, or external rotation of the hip. Okay? So two big ones right there. Again, superior gluteal nerve, inferior gluteal nerve. Now there's another one. It actually comes from L5, S1, and S2. And it's actually going to come from the ventral division. So it's actually going to be a ventral division. Let's do this one in red color. Let's bring here. We're going to bring it off this way. So L5, where we're going to have a branch here from L5. You're going to have a branch here from S1, and it's even going to traverse downwards here, and it's going to pick up another branch here from S2. So what are we going to have here? We're going to have L5, we're going to have S1, and we're going to have S2. This is a pretty cool nerve. This nerve is actually going to be called the Obturator Internus nerve. Don't get this confused with the obturator nerve. That came off the lumbar plexus, right? So this is going to be the obturator internus nerve, or they call it the nerve to obturator internus. But that's kind of deceiving, and the reason why is the obturator internus nerve, not only does it supply the obturator internus, but it supplies another muscle called the superior gemellus. So it supplies two muscles. One is actually going to be the superior gemellus, and the other one is actually going to be the obturator internus. Why is this important? Because these are also deep muscles. They provide lateral rotation of the hip or external rotation of the hip. Okay? So that's going to be the obturator internus nerve. Now there's going to be another one. And this is actually going to be a posterior division. So this was an anterior division. Now we're going to get a branch that's going to be supplying the posterior division. It's actually going to be a posterior division. And this is going to be called the posterior cutaneous nerve. Now the posterior cutaneous nerve, which is it's pretty easy to identify, and you're also going to be able to know that it's actually going to be cutaneous, so it's going to provide sensations, right? And this is going to be picking up branches from S1. It's going to be picking up some fibers from S2, so it'll pick up some fibers from S2, and it'll pick up fibers from S3. So if you pick up fibers from S1, S2, and S3, let's actually bring this one a little bit up. Let's bring this one a little bit up. So let's bring this one like this. Let's bring him up a little bit here. And again, what would the other branch be here? So we already have S1, S2, and there's going to be another branch here, which is going to be S3. Okay? This nerve is important because we already said what it is. It's going to be called the posterior cutaneous nerve. And the posterior cutaneous nerve, as you can already tell, it's going to be having cutaneous sensation. So it's primarily having cutaneous branches. What does that mean? So it's going to be picking up sensations. Sensations from where? It's going to be picking up sensations from, you probably already can tell, guys, posterior what? So it's going to pick up from the inferior booty cheek, right? So from the inferior buttocks, it's going to go down the posterior thigh. It's going to provide sensations to the posterior aspect of the knee, right, which is called the popliteal region. It's going to supply the skin around the triceps surae area, right, the calf, and it's going to supply the heel, right? So that's the posterior cutaneous nerve. So sensations from posterior, inferior buttocks, and it's going to supply posterior thigh, posterior knee, but we also call that the popliteal region. Popliteal region. It's also going to supply the skin on the calf and right around the heel joint. Okay, right around the skin around the heel joint. Okay, so that's the posterior cutaneous nerve. Now, let's do the big mumbo jumbo, right? This is the big mama. This one is going to be very, very important. Let's do this one in a pinkish color. This is going to be picking up a lot of branches. Okay, so if we come for this one, it's actually going to have a branch that's going to come from L4. So let's actually try to do this one very, very particularly. It's going to pick up branches from L4. It's going to pick up some branches from, so we already showed L4 there. We don't need to do that again. It's going to pick up branches from L4. It's going to pick up some branches from L5. It's going to pick up some branches from S1, and it's going to pick up some branches from S2. It's going to move downwards here, and it's going to pick up another branch. And this branch is going to be from S3. Let's actually show this just fusing into this one, right? So this is going to form into S3. So how many branches is this picked up? It's picked up branches from L5, L4, S1, S2, and S3. This is the big mambo jumbo. This guy is called the sciatic nerve, okay? So this is called the sciatic nerve. Now the sciatic nerve is extremely, extremely important nerve. But here's what happens. You get to around the knee, right around the knee joint, just proximal to the knee joint. It's going to get ready to split. And what happens is it splits and goes and provides a anterior division and it goes and supplies a posterior division. Okay? All right, so now we have the tibial nerve, right? So we're going to have a division here. So the sciatic nerve is actually going to divide. It's going to have two divisions. It's going to give off a posterior division and an anterior division. Now the anterior division, you're going to have an anterior division, and then you're going to have a posterior division of the sciatic nerve, right around the actual knee joint, right? Now, the anterior division of the sciatic nerve is actually going to be the tibial nerve. Okay? This is going to be the tibial nerve, and it's going to have a lot of cutaneous and motor supply. The posterior division is going to be what's called the common fibular nerve. And this is also going to have a decent amount of cutaneous and motor supply. So for the tibial nerve, it supplies a lot of different things, right? So let's talk about the cutaneous supply, and let's talk about the motor supply. So what is the cutaneous supply? Well, pretty straightforward for this one. The tibial nerve is going to supply pretty much the entire posterior leg. So it's going to supply the posterior thigh. It's also going to supply a little bit of the popliteal region also. It's going to supply the cutaneous sensation over the actual calf and the cutaneous sensation on the actual sole of the foot. So if we talk about the tibial nerve, the cutaneous is going to supply, as we could really just say, posterior limb, right? And the sole of the foot. So it supplies a decent amount of cutaneous sensation. That's why if there is any type of actual compression of the sciatic nerve, maybe beyond the point where it actually divides, affecting the tibial nerve, you could actually have a lot of paresthesia, right? Pain, numbness, tingling, burning sensations, because this actual tibial nerve is supplying a large amount of cutaneous supply. That's why sciatica can be actually so painful sometimes, where there's actually compression of the proximal part of the sciatic nerve affecting both divisions. We'll talk about that in a second. Okay. Then we're actually going to have the, oh gosh darn it, we have the motor supply. So we have the motor supply of the actual tibial nerve. And the motor supply, he has a decent amount of motor supply. Okay, so what are the motor supplies of this nerve? It can supply the hamstring muscles. So he's going to be one of the primary providers of the hamstring muscles. But we have to be very, very careful, right? What are the hamstring muscles? You know, there's actually going to be the biceps femoris. But here's the thing. He does supply the biceps femoris, but he does not supply the actual short head. He only supplies the long head. So he'll supply the long head, not the short head. That'll be picked up by the common fibular nerve. Then it's also going to supply the semitendinosus. The semitendinosus. It'll also supply the semimembranosus. It'll supply a little bit of the adductor magnus. So it'll supply a small portion of the adductor magnus. It'll even supply the popliteus. So it'll supply the popliteus muscle. It'll supply the plantaris. Man, he supplies a lot of muscles, right? He'll supply the tibialis posterior. He'll supply the flexor digitorum longus. He'll even supply the flexor hallucis longus. And we could even keep going. He supplies the triceps surae, which is made up of the gastrocnemius, and it's also going to supply the soleus. So you know the gastrocnemius, there's the medial and the lateral head, and it plays a role within plantar flexion, right? And it also supplies some of the intrinsic muscles of the foot. Intrinsic muscles of the foot. So he does a friggin' boatload, right? A lot of stuff this guy does. That's why if the tibial nerve is, by some reason, if you have sciatica and you're compressing the actual, either the proximal part of the sciatic nerve or the distal part, like the anterior division, you could have paresthesia within the posterior aspect of the entire leg, right? So pain, numbness, tingling, burning sensations within an aspect, even at the sole of the foot. You also would have a hard time in all of these functions. What are the functions of the hamstring muscles? They play a role within primarily extension at the hip, and they play a role within flexion at the knee. That requires a lot of activities require that. The adductor magnus is playing a role within adduction of the hip. The popliteus is playing a role within flexion, all right? The plantaris plays a role within plantar flexion. Tibialis posterior has many, many functions. You get the point. If these muscles are affected, you would have a very, very tough time carrying out daily activities. All right, so now the other branch of the sciatic nerve, the posterior division, is going to be the common fibular nerve. The common fibular nerve, let's actually do this one in a bluish color here. The common fibular nerve actually is going to have two branches also, right? It's going to have a cutaneous supply, and it's going to have a motor supply. All right, so for the motor component of the actual posterior division of the actual common fibular nerve, what would it actually supply? It's going to supply the other, what? It's going to supply the short head of the biceps femoris. So it's going to supply the biceps femoris, primarily that of the short head. Okay, what else would it supply? It will also supply not just the biceps femoris short head, but it'll supply the fibularis brevis. So it'll supply the fibularis brevis and the fibularis longus. These are very, very important everters of the ankle, so they perform eversion of the ankle. It's also going to supply the extensor hallucis longus. It'll also supply, if we even keep going, it could supply the extensor digitorum longus. And it can even supply the tibialis anterior. So this is also going to be a really, really, really important nerve also, because look what it can actually supply. It supplies a muscle that plays a role within extension at the hip. It also plays a role within flexion at the knee. This is the everter of the ankle. This plays a role within extending the actual big daddy toe, right? And it also is also going to be performing what? It can perform dorsiflexion. It can perform inversion at the ankle. It can extend the digits, and this also can do inversion and dorsiflexion at the ankle. So it provides a lot. Now, common fibular nerve is actually going to be supplying what? If we look at its cutaneous supply, this guy was supplying the posterior aspect. Now the fibular nerve is actually going to be providing cutaneous supply to the what? To the lateral aspect of the leg. So this cutaneous supply is going to be to the lateral aspect of leg. So it would provide what? It would provide the lateral aspect of the thigh. It would provide around the knee joint. It would provide around the actual calf. So this is going to have a lot of cutaneous supply. And again, you can imagine if by some terrible chance the sciatic nerve is compressed, maybe at the proximal points, it would affect the anterior division of the sciatic nerve, and it would affect the posterior division of the sciatic nerve. And if that is the case, look at the amount of things that can happen. What can actually be one of the reasons in which the sciatic nerve is compressed? The most common cause of that is going to be some type of herniated disc. So some type of herniated disc, and we talk about this a little bit within the lumbar plexus. If that nucleus pulposus, right, is actually compressing the sciatic nerve, right? If it's compressing the sciatic nerve, so some part of the lumbar region, what part of the actual spinal cord could actually be compressing the sciatic nerve? Any point in which there's L4, L5, S1, S2, and S3. But to be very, very particular, the common fibular nerve is really only getting its branches from it's actually only getting its branches from L4 all the way to S2. And the anterior division is getting from L5 all the way to S3. So in this case, really, if there is any type of compression on the S3, it would have more of an effect on the actual tibial nerve and less effect on the actual common fibular nerve. Okay, so that's that guy. And again, any type of situation in which there's a herniated disc, it can compress the sciatic nerve, can cause sciatica, an extreme, basically to define it as like a shooting, sharp pain that's running down the actual, It will run down the actual posterior and more of the lateral aspect of the leg, all the way down, okay? So that's a terrible, terrible thing. All right, and obviously then the only way to treat this is basically rest, maybe non-steroidal anti-inflammatory drugs, maybe physical therapy. Sometimes they might even have to go in there and do some type of surgery to alleviate some of the pressure and the stress on that actual nerve. All right, cool deal. Let's do another one. So another one is actually going to be picking up branches from S2 and S1. So let's do this one. Let's do this one in this actual maroonish color here. So if we take this one here, this is going to be an important one because this is actually going to be this is going to be a posterior division of the sacral plexus. So this posterior division of the sacral plexus, this is actually going to be called the nerve to piriformis. And this one's pretty easy. And again, what division would this be? This would be a posterior division of the sacral plexus. So this is going to supply the nerve to piriformis, and obviously you know what it's going to be doing. It's going to be supplying the piriformis nerve. Piriformis muscle, which is a lateral rotator of the hip. All right, sweet deal. Now let's do another one. Let's do this in this doo-doo brown color here. Okay, so now this is another super important one here. Let's actually bring this guy out here. This is going to be picking up branches from what? It's going to be picking up branches from S2, it's going to be picking up branches from S3, and it's going to be picking up branches from S4. Let's bring this one upwards so we can combine it with this guy here. So let's actually bring this one here. And if we have S4, moving up here, it's going to pick up what? Fibers from S3. So it's going to pick up fibers from S3, and then what? It's going to traverse upwards and pick up some fibers from S2. And it is going to be a very, very important nerve, and this is actually going to be called the pudendal nerve. This is going to be called the pudendal nerve. Pudendal nerve. The pudendal nerve is important too, right? Because it's actually going to have a lot of supply, a lot of different types of structures that it can supply. So if we look at it in motor supply, so let's actually look at it in the aspect of a motor supply. So motor-wise, it's actually going to supply the external anal sphincter, right? The structure that's basically helping you from crapping your pants, right? So it's going to supply the external anal sphincter. This guy's pretty good to us, right? Because not only is he providing that, but he's also helping us to prevent us from peeing our pants too. So what else would he be supplying? He'd also be supplying the external urethral sphincter. So bless up for the pudendal nerve, right? Man, because that guy, he saves our butt, right? Literally. Now, there's another branch of the pudendal nerve. The other part of the pudendal nerve is going to be supplying a lot of cutaneous supply. So it does have a lot of cutaneous supply. We're going to have a video on dermatomes and myotomes so that we can have a better understanding clinically of why these nerves are so important, because it can be very, 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 very crucial to determining at what level of the spinal cord, when you look at dermatomes, could be affected. And we'll talk about that a little bit later. So the pudendal nerve, right, it's going to have motor supply to the external anal sphincter, external urethral sphincter. It's going to have cutaneous supply to pretty much the entire perineum. So entire perineum. So for example, if we talk about the male, it would be providing information to it would be picking up sensations from the scrotum. It'd be picking up sensations from around the actual penis. It'd be picking up sensations from around the anus. It'd be picking up information from the skin in between the anus and the genitals, which is called the perineum. Okay, it's also going to be picking up information, if we talk about for the female, it'd be picking up from the clitoris. It'd be picking up information from the labia majora. And if we even keep going, it could pick up information from the mons pubis. So a lot of different structures that this bad boy can supply, right? So again, easiest way to remember for the cutaneous supply that is the pudendal nerve is just remember it supplies most of the actual female and male perineum, which is a lot of different structures which is enclosed within that area. And motor to supply to the external anal sphincter and to the external urethral sphincter. Okay, one more plexus here. Okay, and this right here should actually be L4. Don't know why that put L5 there. Sorry guys. Again, anterior division should be from L4 to S3, and this should be from L4 to S2. That's the only difference, is that this is getting a branch from S3. This is not getting a branch from S2. Okay? All right, now for the last one here. This one's pretty cool, and this is going to be picking up branches from the coccygeal 1. It's going to be picking up branches from S5, and it's going to be picking up some fibers from S4. This one's interesting because it's sometimes forgotten about and not talked about that often, but it is clinically relevant sometimes to determining certain things like, maybe a pilonidal cyst or coccydynia. This basically is going to be called the Coccigeal Plexus. And the Coccigeal Plexus, which is made up of S4, S5, and Coccygeal 1, is going to supply, it's mainly cutaneous supply. So it's going to supply the skin around, what do you think, the coccygeal region. Okay, so it's going to supply the skin around the coccygeal region. This is an important one because, again, if someone might have like a pilonidal cyst, it might actually be picked up by the Coccigeal Plexus, right? So any type of sensations from the skin, maybe some of the underlying tissue. All right. One other thing I want to mention here, which is going to be important here, is a law. We'll talk about it a little bit more in dermatomes, but it's called Hilton's Law. It's not anything crazy. All Hilton's Law says is any muscle that crosses a joint, all right, so any muscle that's actually moving something at a joint. For example, if we take, for example, these hamstring muscles over here, so the anterior division of the tibial nerve, L4 to S3, it's going to supply what? The hamstring muscles. Well, most of these hamstring muscles are going to cross the actual back of the knee joint. So because they cross the back of the knee joint, this nerve, the tibial nerve, the motor supply is going to the muscles that cross the knee joint. Hilton's Law says that it will also supply the skin around that joint. So again, Hilton's Law states that the nerve, if it is giving motor to supply to any muscle that is crossing a joint, it's also going to supply the skin over that joint. Okay? So that's an important concept. And again, it becomes very clinically important. Okay? So what does Hilton's Law state in general? It says a nerve will supply skin around joint to any muscle that crosses that joint. Okay? So that is Hilton's Law. Okay, so again, with the sacral plexus, L4, L5, S1 forms the superior gluteal nerve. L5, S1, S2 forms the inferior gluteal nerve. L4, L5, S1, S2, S3 forms the sciatic nerve. But again, it has two divisions, anterior division, which is only coming from L4 to S3, and posterior division, which is only from L4 to S2. Anterior is tibial nerve. Look at all the massive buku amount of information that this guy's going to be supplying. And then the actual common fibular nerve also supplies a lot of different muscles also, and has a lot of cutaneous supply. And then S2, S3, S4 is going to be the pudendal nerve. S1, S2, S3 is the posterior cutaneous nerve. And then off here we have a posterior division, which is going to be S1 and S2, which is going to be the nerve to piriformis. And then there's going to be a anterior division from L5, S1, and S2. This is going to be an anterior division. And this is going to be for the obturator internus nerve, which supplies the superior glomerulis and the obturator internus. And the last one is going to be S4, S5, and Coccygeal 1 form the Coccygeal Plexus. And then again, we talked about clinical correlations with sciatica, maybe due to most common cause being herniated discs, right? Which is compressing any part of the actual sciatic nerve. If it's compressing more proximal, this person would probably not be able to really walk because of all the things that it's actually affecting. They would have extreme pain, numbness, tingling within a certain aspect of the leg, which is going to be the posterior and lateral aspect of the actual entire leg. All right, Ninjas, in this information, we covered a lot of information about the sacral plexus. I hope it all made sense. I hope you guys did enjoy it. If you guys did, please hit the like button, comment down in the comment section, and please subscribe. All right, Ninja Nerds, as always, until next time.